go. All right, well, welcome everyone. It's nice to see humans in the flesh, and welcome everybody on Zoom as well. We're glad that you were able to join us without having to travel anywhere. I'm Karen Henshaw, and I am the Associate Program Director for the Connections in Health Project. And we are glad that you are joining us for our regional event. The last 3 years we've had an annual conference, and this year we decided we're going to break that up into 2 different events and highlight our community partners. So we're glad that you're here and glad that everybody's joined us on Zoom. So I think what we'll first do is a little bit of housekeeping in person or straight down the hall. Go through some slides. You'll see a transition there in person and on Zoom. So if there are technical difficulties, bear with us a little bit because there'll be multiple people speaking and sharing slides. Can you all hear me okay on Zoom? Audio is cutting out a bit. Maybe I need to stand right here. It's weird because then the microphones are right in my line of vision. Is that better? Sounds better for now. Okay, I'll keep going. You guys, the chat is showing up on our screen. So if there's something that we need to change, you can text or you can chat us. All right, so our agenda today is going to be some community partner sharing. And if you're in the room, you get to be on the stage and talk in the microphone. That is how the people on Zoom can hear us. So I'll introduce you and you can come up and share. And then we have a movement break. We have a speaker who is going to join us virtually and talk about the Indiana Healthy Opportunities for People Everywhere, because that will be expanding across the state in the very near future. So in the next couple of months. And then we're going to do a little networking at the end, because one of the things I miss the most about Zoom meetings is not being able to talk to people in the room and have those conversations just around the table that we would have if we were in person. So we're going to do that virtually in breakout rooms, and then we get to actually do that in person in the flesh today. So that's what we're planning on doing. Okay. So we're going to start talking a little bit about connections in health, and then we'll go into the county engagement and community partners. How's the sound online? Okay, I got a thumbs up. Okay, Alia, go ahead to the next slide. So I just first want to thank Eric and crew for hosting us. There is a lovely spread that you all online are missing with lots of colorful foods, healthy foods to eat. The equipment, the room, fabulous. So thank you, Eric. Thank you, Taylor. Thank you for all the sound help and the technology. So next slide, please. So I want to introduce our team. If you are present, saying hi, so you're up and you can wave, that would be great. Dennis Saviano is our director. He is not able to be with us today. Gina Claxton is our program manager. Should I try the handheld mic? They said the audio is going in and out a lot. Okay. Hold on one second. Hello. How's this? Is this better? Yes, I see someone shaking their head. Okay. Gina Claxton. Sorry, I'm introducing you again. Gina's our program manager. Welcome, Gina. I'm in the middle. Donna Vandergraaf. She is with Purdue Extension. She's a specialist there, and she's also a liaison with our team. Welcome, Donna. Aaron Zitch, program management specialist and our data dude. And then our next slide has our initiative leads, and I'm going to ask each of them to unmute and introduce themselves and invite you to join them.
Hi, I'm Courtney Stewart. I lead the Indiana Joint Asthma Coalition, And our mission is to reduce the burden of asthma in the state. We've been in existence since 2003, and we're doing quite a bit right now in the state to reduce the burden of asthma. I am going to put my email in the chat. So if you're interested in finding out more about asthma in our state and what the coalition is doing, I encourage you to reach out to me and put your email in the chat box as well.
Thank you, Courtney. I am Antonia Sawyer, and I lead the Hoosier Health and Wellness Alliance. We are a statewide health coalition fighting obesity across the state of Indiana. We meet bi-monthly. So we will be meeting on Tuesday, March 9th from 11 a.m. to 12 p.m. if you're interested in learning more about us, or I will also pop my email in the chat and you can send me a direct message. Thank you.
Hi everyone, I am Alia Amin and I lead the Cardiovascular and Diabetes Coalition of Indiana, and we meet every odd month, the second Thursday of every odd month from 2 to 3. So we also have a meeting coming up next week. Would love to have you on board, and I will also drop my email in the chat. Nice to see everyone.
Thanks, Alia. My name is Lawanda Gerton, and I am the Cancer Control Prevention and Equity Liaison between Connections and Health and the Brian Simon Comprehensive Cancer Center. We want to talk to all of you and have an opportunity to connect and just discuss regarding cancer. So I'm going to as well place my information in the chat. Thank you.
Great. Thanks, everyone. Feel free to reach out to any of these fine team members if you have questions or would like to know a little bit more about what they're doing. This screen has our students. I know not all of them could be with us today, but if you're there and you want to wave, that would be great. Lily Derbyshire is our research associate for a few more months anyway, till she gets her PhD. She's been doing a lot of social network analysis and functioning and effectiveness surveys for our coalitions. Crystal O'Donnell is also just with us for a couple more months with a doctoral in nursing at Rush University. Milan Gaston is a Master's of Public Health intern with Indiana University. Bridget Reed is a project associate. She's at the University of Indianapolis. And then Julia is a dietetic intern at Indiana State University, and she's just with us for a few more weeks. So welcome everybody. If you happen to see them behind the scenes, they're busy doing all kinds of things. So thank you. Okay, I'm going to turn this slide over to Gina.
Hey, good afternoon. I've been asked to just give a brief overview of the Indiana Clinical and Translational Sciences Institute. It's a really long name of the organization I'm part of. The abbreviation that we often throw around that you might hear is the Indiana CTSI. And so the Indiana CTSI is an official research partnership between Indiana University, Purdue University, and the University of Notre Dame. And we work all along the research spectrum from what you would think of as typical lab sciences to public health and community engaged research. And so we do this work in partnership with several different stakeholders. Some of them are shown in that outer circle of the image there, from government agencies, statewide agencies, community organizations, and then of course we engage with members of the public as well. And briefly, within CTSI, we offer community engaged research funding opportunities. So I want to make sure that we share these opportunities with all of you here today. We do have a call currently active for applications. So anyone interested in applying, the time is now. There are two. The first one is the Trailblazer Award, and this is for up to $25,000 to do a research project in partnership, the community representative and an academic representative together in the state of Indiana. Applications are due June 1st. We are interested in supporting all areas of health research, health improvement. We do have an emphasis on health equity. There's a link, if these slides are going to be shared, there's a link for more information embedded in this slide. And the second funding opportunity, also active right now, the application due August 1st, is for a partnership award. So $5,000 to help you build partnership with someone you want to get to know better, finding out where you might be able to collaborate in the future. So this award would support things like networking, data sharing, just getting to know each other, and defining some shared goals for a potential research project in the future.
Great. Thank you, Gina, for sharing. Can you all still hear me in the room? Okay, so I just wanted to share also that we will share these slides, and this is being recorded, so we will send that out to everyone so you can share it with others if you want, and you can click on the links that are on the slides then if you want more information. Also, those of you online, feel free to use the chat box. If you have questions, Aaron's going to monitor that and let us know if we've got questions. And those of you in the room, if you've got questions, I will try to remember to pause in between and share the mic if you have a question. Just kind of wave at me or something so I know that you have something you want to ask. Okay, so just real quickly, Connections in Health came about in 2018. It exists with 3 coalitions that are statewide that are funded through the Indiana Department of Health, and they were in existence long before Connections in Health, but they came under one roof, I guess, in 2018. So those 3 coalitions are the ones that Antonia and Courtney and Alia mentioned: Hoosier Health and Wellness Alliance, the Cardiovascular and Diabetes Coalition of Indiana, and the Indiana Joint Asthma Coalition. And then we also have this really fabulous partnership with IU Simon Comprehensive Cancer Center, which is LaWanda's role there with the cancer control, prevention, and equity. Our hope is that we can have a positive impact across the state of Indiana on health, all aspects of health. We have certain areas of chronic disease focused with our coalitions, but we are hopeful to do that with working with coalitions locally. And I'm going to let Aaron then share about this slide.
Wonderful. Thanks, Karen. As she mentioned, our goal is to cover the entire state with these coalitions, and we love to keep track of where our members are so we can connect the right folks with people within local communities like Grant and Blackford to be able to get connected on a state level, networking and whatnot. And so we use a membership inquiry, and I'm dropping it in the chat. So if you are already a member of one of the initiatives that Karen just mentioned, the statewide coalitions, and you haven't filled that out, we don't know where you are for this year. We ask our members to fill that out just to tell us what capacity they serve the state. And we have about 100 folks who have filled it out this year. And you can see we've got a wide variety of folks in different areas that are a part of these coalitions. We've got some work to do in North Central Indiana. But you can see where the density is, where we have a lot of folks and where we don't. So we look forward to hopefully getting some new coalition members. And if you are an existing coalition member, hopefully you can fill this out so that we know where you are and we can connect folks with you when we need to.
Thanks, Aaron. You will see a few QR codes along the way. If you're in the room, you can use your camera and scan that most of the time, even from where you're sitting. And if you're online, you can still scan that with your phone if you are interested in going there. Okay, thanks, Aaron. So just a quick snippet about how we got here. County engagement is how we got here. So there's 92 counties in Indiana. It's really hard to consider how we're going to build deep relationships with a small team in 92 counties. So the strategy that we chose to use was to engage in 2 counties at a time every year. So we started with Grant and Vermilion County. It's all based on data. So the little puzzle pieces over there, there's data in the middle. A ton of data from Aaron, who I called our data dude earlier. He actually was a student intern with us that summer and put a lot of information together. Kind of ranked the counties, looked where there was most opportunity, looked especially at the chronic disease areas that our coalitions focus on. And then we talked with our partners. Where do you have existing partnerships? Where do you think there are coalitions or people in the community who are interested in addressing health challenges and would want to work with us? And where do you see the most opportunity for growth? So all of that to say, these are the first 10 counties on the map that we have the plans to engage with. Vermilion, Grant, and Blackford, we feel like we have pretty good relationships and have engaged successfully in those counties. We're right now working in Washington County, and we're just starting the process in Lake County. Madison County will come later this spring. And then we have Clay, Stark, Marion, and Jennings counties to select from in the next couple of years. So if you're in any of these counties and you have not connected with us, please feel free to reach out to us. If you're in Lake or Madison, reach out to us any moment because we are ready to start having conversations there. Stark, Marion, Clay, and Jennings will be having a discussion here in another couple of months to determine next steps and where we'll go next. So that's kind of how we got started. Go ahead to the next slide, Alia. Here's information. Here's information about Lake County. So if you are part of Lake County, there are 4 zip codes that we're specifically interested in talking to people in. If you have connections there or are connected there, we'd love to hear from you. Feel free to reach out to us. You can put your information in the chat or you can talk to me if you're here in person. Okay, now the next slide is the word cloud from Grant County. So we did a bunch of listening sessions, around 50 in Grant County, and this is what we heard from people in Grant County. These were the challenges that people said were most concerning or most important for them to address. And this is a word cloud, which means the larger the text, the more times it was mentioned. So you can see lack of resources, food insecurity, substance use, mental health. The lack of community and lack of individual is a phrase. So lack of community is the community collaboration and communication. So those are a lot of the challenges people shared with us to begin with. Go ahead to the next slide. This is what Grant County folks decided they wanted to work on. So they wanted to increase community communication and collaboration. So what we're going to do now is we have a list of Grant County partners that are going to share with us and give us some updates on what they've been working on. Alicia Hazelwood is joining us online and will be sharing her screen momentarily. We have a community funding project that Alia is going to describe, and Stephanie Gray at Marion Health has been working with us on, among others. Actually, everybody on the screen has been working with us on this and others. Amy's here in person to talk about Breathe Easy Grant County, and then Pam and Kelly are also here in person to talk about CORE. I think Alia is going to stop sharing and Alicia is going to share her screen and show us about Charity Tracker.
Okay, so can everybody hear me okay? First of all,
yes.
Awesome. So I'm really excited. I'm looking at the list of people from Grant County, and I think I literally just left the meeting with all of them in regards to our substance abuse task force. So I appreciate the opportunity to share virtually. And part of the reason I'm doing that is because I want to show you guys something that the United Way of Grant County has been kind of looking at doing for a while. We've now funded it. We are getting Charity Trackers. So we are going to use this system, hopefully, as a way to better connect our community to resources. Some people in the community think, oh my gosh, we're tracking charity, like we're going to make sure people aren't double dipping. But really what we're planning on using Charity Tracker for is hyper-resourcing families, so that the moment they touch our circle, we will be able then to resource them to other things in the community that they can utilize, with the hopes that if we resource them well up front, 5 months from now or a year from now, we won't be seeing the same family over and over for an additional need. So here's Charity Tracker. I will log in so that you guys can get an idea. This is a completely active system, so we have access to it. I will be creating a meeting here in the community where we'll get anyone who's interested in utilizing and being a part of Charity Tracker together to get trained, to look at it, to really kind of get it up and going. But I just wanted to give this group a quick look at, and if you want to drop in the chat, Karen, do you mind, or Aaron, catching the names of anyone in the group who is interested in Charity Tracker. I'd appreciate that. So you will log in and you'll actually see this front page, and we have the pro version. So this is what your homepage will look like for your organization. And you'll see this community dashboard. That's literally everyone that uses Charity Tracker in the community. You can immediately see the number of people served, acts of kindness for those of you that know what an in-kind gift, like someone gave a load of wood for someone that heats their house, that would be an act of kindness gift, and then actual dollars of assistance. What I loved is this bulletin board. So when you log in, if you have something where you can post it to the bulletin board, hey, I have a client who is in need of firewood to heat his home. Does anybody have anybody I can connect with? And you actually can create a bulletin and post it with a title, what you need, an expiration date. So I'm only going to work on this for the next 2 weeks because after that, I don't know what to do. So you can close it. When you add the bulletin, it pops up. And if I were to click into it and say, yeah, I can help with that, the bulletin goes from red to green. So the rest of the people that see that bulletin know that that's been taken care of and that's a need that has been met. For those of you that do choose to participate, and I just will do a high level, you will actually in this My Agency tab, this is where you will have information specific to your organization and your agency. Agencies, this is where you can kind of research the different agencies that are in Charity Tracker, and I have an admin page. Under My Agencies, you can see your cases, assistance, categories. We actually have the ability to do barcoding. So we can actually get clients an ID card with a barcode on the back that we can just scan. So that saves the clients and you time. If they're already in Charity Tracker, they don't have to do intake forms for you as well. This is all HIPAA compliant, so we don't have to worry about that. And the agencies have the ability to limit or open up their accounts as much as they choose to other organizations. So you don't have to worry about, well, I don't mind Family Service Society having medical information, but I don't want St. Martin's to have it because it's not really useful. You have the availability to customize that as you want to. And then they have reports that you can pull down, all of these different types of demographic reports and information, not only for your agency, but we can then pull them as a whole county. Something else that I wanted to share for those that are in the room, this hopefully will be a way for agencies to connect, to easily refer clients from one organization to the other. So we're hyper resourcing those families. It is free to Grant County. The United Way is completely underfunding this. So there is no cost to utilize Charity Tracker for your agency. And that is something that as we see how many people are utilizing it, what information we're getting out of it, then we can expand that hopefully and keep it going as a resource to the community. So it is kiosk friendly as well. So you can actually click the kiosk button, enter kiosk mode, and the client can actually fill out their own Charity Tracker information. I know some people have said, hey, wait a minute, I don't have a staff member to do this kind of information entering. You can actually do that through the Charity Tracker kiosk mode as well, which I think is kind of interesting. And there is other clients worry or agencies have said, is it, are there release information? We do have privacy release information. Now I can't get it to go out of, oh, wrong button. This one. Exit kiosk mode. There we go. There is release forms already in this, so we don't have to worry about can I release client information. There is already a release of information set up inside the system for you to utilize as well. So I think it's hopefully going to be a really great resource, not only to be able to report back to our community really what we're doing, but in Grant County, we do hear like our agencies don't really talk to each other. They work in silos. And I always giggle because that seems interesting that people think we can do this work by ourselves in a silo, but utilizing this will really give us the data we need to say, no, we don't. Here's the proof we don't, and that type of thing. So we're excited to offer that. And again, if anybody has any questions, just give me a call, stick your information in the chat, and I'll make sure as we kind of roll this out and pilot it, that we're getting everybody who's interested included.
Thank you so much, Alicia, for sharing. So those of you across the state that are joining us online and in person, just a note that one of the reasons we wanted to do this is to share what's happening in Grant and Blackford. And if there are other folks across the state who are interested, you can reach out and network with the people that are sharing today. Also, if you have already used Charity Tracker, or if you have ideas for these communities, and you want to share with them your words of wisdom, then we also encourage you to reach out. So please feel free to use this as a networking opportunity. Feel free to use the chat box. And if you're in person, feel free to work through me, and I'm happy to get you connected. So thank you, Alicia. Okay, I think Alia is going to share screen again, and she's going to talk about CADI community funding.
Hey everyone, I am. So in the counties that we engage in, we have CADI is able to grant $10,000 to that community to implement a community-led evidence-based project. And this can be to build upon an existing project or to start something new. And the process, you guys have been through it. We have some town halls, put together the focus group, hear from you, identify successes, challenges, and land somewhere, and help develop the project, provide resources and support as needed. And the goal is to build something sustainable and build some momentum to improve health, specifically in the areas of cardiovascular disease, diabetes, and or stroke in those communities. So the first project is going to be, I'm going to hand it over to Stephanie Gray for Grant County, and she's going to talk about the Grant County Mobile Kitchen Project, which is where we landed on for the CADI community funding in Grant County. So, where's my slide? There we go. And Stephanie, you can talk about that. I think Stephanie said that she was traveling maybe, so she may be having some connectivity issues. So Alicia has also this project. If you want to go ahead and take it from here, Alicia, go ahead.
I was saying in Grant County, we always have each other's back. So I was going to say, I can help Stephanie out with this one, and we giggle because it's been her and I creating this. So the United Way of Grant County is kind of the house for the money. We're the fiscal agent for this particular project. Oh, there's Stephanie.
Yay, did I make it?
You did make it. I was just getting ready to get started. So it is on, girlfriend.
If you want to,
just
you can.
in time.
Well, I had been on the call the whole time, and then I had to leave where I was at anyways. I'm in Middlebury somewhere. So if I cut out, I'm so sorry. But yes, so we worked together for the mobile kitchen. One of the things that came out of the surveys and the questionnaires and the town halls had a lot to do with individuals' ability to cook and make healthy foods and how to get started with that. And so we kind of put together some ideas and have decided that we're going to do a mobile kitchen, and we have all the equipment and everything now. It's in my storeroom, and I'm getting it all together. So that any community can borrow any type of equipment, any type of nutrition, education, and cooking class that they might think that their community members would be interested. Say, if someone from the mission wanted to do and there would be like a hot plate and things like that that they could use to do the education for what would be likely that individuals who would go to the mission would need as their cooking utensils. And then Parkview Heal program was nice enough to lend us their entire curriculum free of charge, so that all the educational tools are available for whatever group wants to use them. So we were trying to get a kickoff for February with National Heart Month, cardiovascular disease, but Omicron sort of stifled our ability to do that. So we're still working on a date that would be good to do a kickoff in combination with the YMCA. So. Did I lose everything?
You are good, Stephanie. You covered it
Okay.
all.
Thank you.
Thank you so much. Appreciate it.
Okay, I believe I'm next. I am Amy Ingram with Breathe Easy, Grant County, and our host site or lead agency is Marion Health. And so who is Breathe Easy Grant County? This is a picture of, or part of us. So we are a coalition of volunteers, and we are passionate about making a change in Grant County by focusing on the #1 cause of chronic disease and death, tobacco. So we partner with just about everybody. We partner with employers, schools, multi-unit housing agencies, businesses, elected officials, you name it, and we're there. So in the last 2 years, 3 years, we have reached over 3,600 students with our virtual classroom. We have, sorry, I don't know if you have heard me online, we have presented over 293 times in the last year and a half. We have reached over, I think, 300 and some odd adults in presentations. So communication and collaboration is our #1 focus, and how to prevent and prevention, education, intervention when it comes to tobacco, nicotine initiatives, and cessation, of course. So we meet once a month at Marion Health. It's on first Tuesday at 2:00. It's a hybrid meeting. So if you think, I really don't feel comfortable going to the hospital during a pandemic, we do have the opportunity to go virtual. So if that is something that you're interested in, the next slide is all of my information. And I'd be more than willing to answer questions at a later date.
Tell us we're on a time schedule. Wanted to talk a little bit about the CORE program. About 2.5 years ago, Marion Health applied for a large community grant, and part of that was to create a consortium. As we talk about collaboration, we actually have 20+ organizations now that at one way or another impact people who are involved and families involved in substance use. So it does stand for Community Opioid Response Endeavor, just left my brain. And so as we look at that, it's not just about opioids, but we didn't have any other acronyms, so we just stuck with opioids. But the 3 main components that I want to mention briefly is we're obviously looking at primary prevention, wanting to get into the schools, and then look at prevention of overdose and death, and then treatment and rehab, and keeping them in recovery. And so as we look at those 3 things, the most exciting things that have come out of it that are making a huge impact, and you'll see stats there at the bottom, and I think they'll probably share this with participants. The stats are on there. Don't see them, but anyway, we have taken over 800 people to inpatient treatment this year with our peer support specialist. And peer support specialist is someone who's in active recovery themselves. And they are called to the hospital when there is someone who comes in with a substance use issue, in particular overdose. And then they start meeting with that be that resource when that person is ready to quit or to start looking at resources. So in the meantime, because we have learned in this, until a person is ready to quit, there's not much you can do. And so we want to be resources for them all the time until they're in that contemplative mode where they might actually another exciting piece that has come out of this is what we call pro-social events. So we have been recruiting churches throughout the community to host what is called a pro-social or pro-family event. Many of the people who are in recovery or just right out of active addiction have broken a lot of family relationships and friends. They don't have much money and they have to have entertainment where there is not substances. So even going to a Pacers game, there's alcohol, you have to be careful with all of that. So we've asked our churches, and some of our area things are actually sponsoring events where they feed them and have games and just activities, maybe a concert. And so that has been a really eye-opener, also been a good stigma. I know at my own church, when we hosted it, we had people from our church there. And when they heard the stories of people, they saw people that are in active recovery, all of a sudden, whatever they pictured as the typical drug user changed, because it hits all strata of our economy and all of our people. And as you looked at that word cloud earlier, substance abuse was one of the biggest words. It is a huge impact on our health outcomes here in Grant County. So we need to continue with this consortium moving forward on how can we make a difference with people who are impacted by substance use. Next. Oh, go ahead. Okay. What was the question online?
We've got one question that says, are these pro-social events open to drug court folks so that they can phase up and out of drug court?
Absolutely. They're open to anybody in the community. And actually, we have a rep from the drug on our consortium. But yes, drug court also sponsors some pro-social, and then CORE does. So we're really hoping to continue to expand those. Any more questions?
That's it for now.
Questions in the room for Grant County? Questions online? Okay. Yeah, do feel free to please use the chat box online if you've got questions. Okay, so we are now going to move on to Blackford County. So I'm going to share a little bit from Sherry Steiner. She's not able to be with us today. And then Lindsay's going to share. And then we have Eric Hayes here, who's also going to share. So the first slide for Blackford County is a request for participation. So if you're connected with Blackford County, you can go to the second slide there. Alia, there's a little bit more information. So there is a study. This is actually a Trailblazer Award. So Gina mentioned earlier, there's grant funding that can be used for research projects out in the community. And so there is a group from Blackford County and also some researchers from Purdue, Fort Wayne, who are looking for people to participate in a study about heavy metals and adult health. So if this is something that you are interested in and you are connected in Blackford County, we would welcome for you to participate. And there is an email address and a phone number there if you want to contact Dr. Steiner directly. I'm going to ask you if one of our team members could quickly type that email into the chat box so that everybody has that they can just copy and paste if they want to. And now I'm going to turn it over to Lindsay Cox.
Thanks, Karen. Hi, everybody. I'm Lindsay Cox. I work with Purdue Extension, Blackford County. And this is some of our team that we get to work in community and health. So Sherry Brown, myself, and Janelle Franks. Next slide, please. One thing that was very helpful when Connections in Health came to Blackford County to start engaging was that we had an existing health coalition called the Healthy Community Alliance. It is through our regional hospital system, IU Health, and they use the collective impact model on reaching audiences. So partners can join the alliance free of charge, and it's all about eating better, moving more, and not using tobacco. And if you're an organization that is part of the alliance, chances are that you probably have your own trusted network. So that's how the messaging is proven to be more effective. And so those are Delaware, Blackford, and Jay counties. Our Blackford work group meets every other month on the second Friday. So the next meeting will be Friday, March 11th from noon to 1. It will be on Teams, or you can come to the extension office and we do a little viewing party in the front lobby. John Disher can get those invitations sent out. So Alia had mentioned the CADI funding when Connections and Health is actively engaging in a county. So that was last summer when we got to have our town halls and meet with people. So we ended up coming with a Passport to Wellness series to really help set the stage for larger community change. Next slide, please. I think kind of like Grant County, one of the things that showed up was healthy opportunities and knowledge of how to make the healthy choice the easy choice. So this was a word, like an infographic, I guess you could call it, that was created from our 3 town halls. I have a paper copy at that front table here in the room. So if you want to take a look at it afterward, that's out there. Next slide, please. And so Passport to Wellness, we thought, well, let's show up at existing events and have blood pressure screenings, other sort of screenings, healthy recipes and samples that are tasty and easy. One thing too that we want to do is host dining with diabetes classes, which Janelle can do. We've got our nutrition ed program advisor in the office who has helped with this. The invitation clinic through Taylor University, major partners. We did some of this last summer and fall and then kind of hit a plateau, but we're back at it again as events are starting to happen, showing up. And we want to have some sort of a fun culmination event in the spring or summer. We're hoping to maybe partner with a high school health careers class at Blackford High School to have maybe a fun run component. Next slide, please. So these are the passports for the health screenings. We have paper copies at that table as well. And Taylor University folks designed these and they are beautiful. So you can track all sorts of things: blood pressure, sleep habits, nutrition, physical activity. Next slide. Our other passport, we designed the content at the extension office, but then a Connections and Health intern helped design the actual passports. Again, we have paper copies back there, but ideas to help make the healthy choice the easy choice. And there were all sorts of emotional health, physical health sort of things. Next slide. One of the things that we showed up at was the Invitation Clinic's grand opening in downtown Hartford City in August. And people online, the food spread there is very similar to what we have today, and it's delicious. I'm sorry you're missing it. Another event that we showed up at was the 4-H Fall Festival and Trunk or Treat in the fall. Pictured on the left is one of our community champions who has really been integral to the Connections and Health engagement process. Next slide. Enhancing the value of public spaces. So also thanks to our involvement with Connections and Health, we have been involved with the Hoosier Health and Wellness Alliance and specifically the Parks Board Working Group. So thanks to Antonia, she helped secure funding for us to implement EVPS, Creating Healthy Communities, and we are kicking off in April. We have our core leadership team finalized, which we have a couple of those people in the room today too. And it's all about really looking at what you have and what you want and developing a tangible plan of how to get there. So these are reachable goals. And the cool thing about EVPS is that the report that you end up with at the end can be used in other things, such as our county strategic plan that is ready to be updated. And we will be creating a parks master plan, send that to the Indiana Department of Natural Resources for approval. And then that makes us more eligible for funding. And one really neat thing that's been going on in Blackford County is that we have a lot of different health work going on, whether that's parks, trails, healthy eating, mental health, substance misuse. So this has given us the opportunity to try to put it all under one umbrella and get people even more connected. We've got one of our mental health people in the room today as well. So it's been really great to have so much overlap going on and working better together. And that might be my last slide. contact information, please reach out to us.
All right, thank you very much. My name is Eric Hayes, and I represent Taylor Invitation Health and Wellness Program. This was a partnership that was started about 4 years ago now with what was Marion General Hospital, and I guess you guys are Marion Health now officially, where they opened up space in the back of a clinic here in Upland and allow us to open a chronic disease treatment and prevention center. Really focused on diabetes, but as you know, everything that causes diabetes causes every other chronic condition out there too. So we really work with anybody. And our primary means of getting patients was through primary care providers. And so Marion was very gracious to give us space and then connect us to the rest of the providers in Grant County. And so we gradually grew the program. If you go to the next slide. This is just a picture of one of our student health educators. So we train students who are interested in healthcare. That can be a number of different majors, from public health, psychology, social work, pre-med, kind of you name it. If they're interested in working with people, we train them as health educators through a semester-long course to deliver a CDC-approved diabetes prevention program. And over the last 4 years, we've basically contacted about 150 patients have come through our clinics now. This past year, the Lilly Endowment was very gracious to give Taylor $1 million grant, and Taylor chose to go after this program as kind of a pre-med curriculum. So that allowed us to open an additional clinic site in Hartford City, which we did this past summer. If you go to the next slide. So our community partners in Blackford County are the IU Health physicians at the hospital, and then Jennifer Clam is an independent provider, Reliant Healthcare. She's right next door to us. I don't have a picture, but right next door is our facility. And then we've also just started through Katrina Riggin, who is the cardiopulmonary bariatric and oncology services director for Blackford, Ball, and Jay counties. It's a mouthful. Doing a community home health paramed program. They already had this program going and they've been tracking hospital readmissions, but we decided to pair our health educators with the paramedics to go in and deliver educational programming and a hybrid cardiopulmonary service. And so they're going to track hospital readmissions and over the next couple of years as we do that to see if we have an impact on that. And if so, then they'll continue to support the program in that way. Next slide. As I said, we deliver a CDC program, but we had not received recognition from the CDC. And so the Indiana Department of Health was very gracious in the last 2 years to give us $25,000 in grant money to train students via the CDC to deliver the program. So we've just submitted our first round of data for that, and we're now recognized in the state as being one of the providers of a diabetes prevention program. And one of our professors will be becoming a master coach soon, so that all of our students who go through the education get certified as CDC diabetes prevention program providers. One more, next slide. And then through our connection with CADI and the Indiana Department of Health, Alia was very gracious to work with us to get us another $10,000 for the Heart Healthy Ambassador Program, which is a new CDC program. They wanted 3 pilot programs in the state of Indiana. So we're one of the 3 pilot programs to do a self-monitoring blood pressure program. And about 3 weeks ago, we had 12 students and 2 faculty trained. And so again, that'll just be implemented into the invitation program, and we'll be doing that as well. And then do I have one more? Nope, just questions. So, oh, the PR campaign. Yeah, sorry, Lindsay just reminded me. And then tying all this together that Lindsay just mentioned, what we're doing is that one of our faculty here at Taylor leads a PR campaign PR class that's by invitation only. So she invites kind of the cream of the crop students from marketing, design, media, film, writing, kind of you name it, everybody that you would need for a PR team. And so they are leading a PR campaign for Blackford County this spring related to all of these initiatives and kind of tying them all together. So that's kind of a boost we get to all of this spring with those students. Yep.
Thank you, Lindsay and Eric. Anybody have any questions for our Blackford County partners? Lots going on. Yes, exciting stuff. Okay. I think next we have a movement break. Is that right? Yep. Okay. So Alia is going to stop sharing. I think Aaron's going to share a video. So if you're on Zoom and you want to turn off your camera, that's fine. If you're in the room, sorry. but we're going to do a movement break. And I tried to find something that wasn't going to put our behinds in the air too much. So I'm sorry if there's something in here that makes you uncomfortable. Don't do it. It's okay. But we're going to do a little bit of a movement break. One of the things that we've been trying to do with Connections in Health is to build movement into our day, because we are sitting in meetings all the time and we're on Zoom. We're still working remotely for the most part. So we're on Zoom all day and we don't get up and move. So we're trying to practice what we preach. So I'm going to put the microphone down and not be on the stage for this. And Aaron is going to, Aaron's going to go ahead and share this video.
I'm so glad you're joining us for a quick movement break. You should aim to integrate movement into your workday at least every 30 minutes of uninterrupted sitting time. Doing so can reduce your risk of weight gain, high blood pressure, and obesity. Let's get started. Begin by standing. Root both feet into the ground. Take a great big inhale and reach both hands high above your head. On your exhale, goalpost the arms and lift the chest, finding a baby back bend. Back bends can quickly boost your energy levels and help to refocus your mind when dealing with stress. Let's do that one more time. Inhale, reach up. Exhale, lift the chest and goalpost the arms. Place your hands down by your side. Now bring your right knee up to your chest. Try to balance here as long as you can. Feel the stretch in the back of your leg and lower back. Now slowly bring your foot back behind you and pull it towards your glutes, stretching through the front of your hips. You may want to hold on to something in order to help keep your balance. Let's switch to the other side. Bring your left knee up to your chest. Try to balance here as long as you can. Feel the stretch in the back of your leg and lower back. Now slowly bring your foot back behind you, pull it towards your glutes, stretching through the front of your hips. Bring both feet back together. Next, bend your arms by your side and begin to twist right and left, opening up into your sides and spine. You can leave your arms bent or straighten them out depending on the space you have available. Twisting the spine back and forth can help relieve any tension in the lower back from sitting. Lastly, place your feet about hips distance. Then place your hands onto your hips. Take an inhale and lift the chest up, and exhale, slowly beginning to lower the chest down. As you begin to fold forward, bend the knees to begin lengthening through the hamstrings until your chest touches the tops of your thighs. You can dangle your arms down towards the floor or grab onto your elbows. Stay here to continue lengthening through the spine, or you can sway side to side. Bring the hands back to your hips, and on your next inhale, slowly begin to rise up. Head comes up last. Great work on integrating this quick physical activity break into your busy day. Setting a reminder on your phone or computer can help you remember to fit in regular breaks. Breaks don't have to take up too much of your time and can be effective with just a few short minutes. Low-intensity activities such as standing can be just as beneficial as walking. We encourage you to take a stand against sitting.
Okay, at this time, we are going to take a quick break. Those of you at home, I hope you can go find a yummy snack, because there is a beautiful spread here for people in person to enjoy. We're sorry that you're not able to be with us, but we are going to take a quick break, let everybody get some snacks and drinks, take a bathroom break if you need to, and we will be back together shortly. All right, we are going to come back together. Everybody in the room, I'm so sorry. I love all the networking. We are going to come back together though. There's so much talking, they can't hear me. I'm going to try this mic. Not that mic. Okay, I'm going to introduce now Tisha Reed. So some of you may have heard or known Tisha when she worked with our team. She has now moved on to work with the Indiana Healthy Opportunities for People Everywhere. And so she is going to join us today. And I just saw her beautiful face show up on the screen and talk to us a little bit about what the I Hope Project is and what that's going to look like across the state. Welcome, Tisha.
Thank you. Thank you for that introduction. Are you seeing my screen with just the PowerPoint? Can someone talk to me because I can't see?
Yes, yes, we can see it.
Okay, great. All right. So again, let me go back. I want to just thank everyone for this opportunity to share and be with everyone on today, as I am standing in the gap for our program director, Holly, last name Wood. So Holly Wood is our program director. So standing in for her. And so I'm going to talk a little bit today about this initiative, and hopefully you will be able to get some insight onto what I Hope is about, how we are moving forward, and looking forward to hearing the voice of the community to drive health equity. Right now, we are scheduled to be in 30 counties. And within these 30 counties, we are looking to see how we can definitely make an impact as we look at health disparities in the communities. As we know, each community has its own flavor, has its own culture, has its own way of doing things, and some of their own issues that they may be dealing with. So over the next 2 years, I hope we'll focus on 30 counties to address these barriers to care that exist for people living in rural areas, minorities, and people from different cultures and backgrounds. From healthcare associations, coalitions, and state agencies to faith-based organizations and universities. I hope partners are collaborating to improve these multiple conditions that affect health, such as nutrition, affordable housing, transportation, childcare issues, and safe and secure employment. So some of you may say you may have heard of IHOPE, and then some others may not have heard of IHOPE. So what is IHOPE? IHOPE is a partnership between Purdue University, the state of Indiana, and over 100 other partners. And that list is continuing to grow. Our shared goal is to improve community level health outcomes while ensuring populations disproportionately impacted by the pandemic have a seat at the decision-making table. We want to be better prepared as a state to successfully and equitably navigate the next natural disaster or pandemic together. And so what you're looking here at right now is we looked at the pandemic vulnerability to guide this work. We looked at the social vulnerability index as well. And so those states that you see that are high in red are those who had a high number. So our first 5 counties that we are focusing in on this year are Wayne County, Lake County, Davies, Cass County, and I think it's Evansville, are down here at the bottom in this southern region. So we are trying to make sure that we are addressing those, and those that you see in the pink area are the next counties that we will address, and then the lighter ones as well. We will be in 30 counties basically in this next coming year. And so we have a large statewide collaboration in which we are all working to make sure that we can identify these communities and their health priorities and work to eliminating some of the health disparities. The PVI and the SVI, the Pandemic Vulnerability Index and the Social Vulnerability Index, identify these communities at risk for experiencing health equity in the areas that you all are familiar with. So that may be military and veterans and their families, essential and frontline workers, people who are justice involved, incarcerated persons, persons not born in the US, LGBTQA+ community, people over the age of 65, racial and ethnic minorities, and people living in rural areas. And there are others, those dealing with substance use disorders, as we heard about a little bit earlier on today. And then also, we have been lucky enough to partner with also Partner Extension, being a part of Purdue, and the Brian Lamb School of Communication, and the College of Health and Human Services. And that is to be able to increase and have a collective impact as we look forward to additional opportunities across the university to expand that value that we bring to each county in Indiana. And so let me go on and move to the next slide. Now, you all are probably familiar with this as well, that your zip code is more accurate at determining how long you are going to live than your genetic code. And so we put this here as a reminder that we know that that we have a lot of work to do in social determinants of health if we're really going to make a move in the area of health equity. What is our approach? Our approach for IHOPE, for Indiana Healthy Opportunities for People Everywhere, is we want to look at having a statement deployment of field implementation teams. We're using a multi-sectoral partnerships and thinking of everyone engaging the lives of people and families as catalysts for positive public health change, from schools to first responders, healthcare and public health, but also non-traditional partners to come together and create innovative solutions that meet that individual community needs. After all, we know that the communities are experts in themselves and their experiences. So we have these field implementation teams, and we are going to make sure that the teams are doing is they're going to look at these, they're going to have some call to action meetings, and they're going to talk about some of these focus areas like chronic disease, substance use disorder, trauma-informed care, mental health. They're going to look at all the different barriers that are unique to those particular communities. And we're planning to put together a campaign that is linguistically and culturally appropriate in these different communities to raise the awareness and hopefully also bring some other people together. And while we're bringing and convening large groups together, and we know that there are some that are already they already have a great group of people working together. So it's not to duplicate services or anything like that, but it's to see how we can enhance the efforts in those different communities, how we may be able to help and assist with funding opportunities, for example. And so our approach is making sure that when we leave the community, that or the work that we're doing in the community, that they leave together with a strategic action plan. So a lot of times we know we have meetings upon meetings upon meetings, and that's not what we want to do as we are in the communities. We want to make sure that we are taking advantage of our field implementation teams. Oops. And these field implementation teams or intervention teams have a lead project manager, a senior health equity analyst, and lean advisors who work. The lean advisors work in process improvement. And this process improvement area is really to look at what is being done, what are people doing in the communities, and how is it that we can help advance the work at the end? What are the processes? What do we need to cut out? What is the fat? What is that we can cut away to help move this along quicker or faster, so that at the end we have a cohesive team that is working very well together and at a quicker rate, so we can see the impact in those communities. These field implementation teams have also worked together. For example, in Wayne County, there's a community-informed participatory engagement where we are working with they have this community forum right here brought together the sheriff department, those working in substance use disorder, those that are working in shelters, those that are working in housing, those that are working in the transportation area. They brought emergency people together, all of this to see how we can really work well together as phone calls come in for those who have possibly looked at ODing, or people who have mental health, dealing with mental health issues and things like that. Working on a system that can really get to the individuals quickly and can make an impact in that area. Our other things that we are doing, we have our call to action meetings. We just held one in Lake County on this past week, and Dr. Jerome Adams was the keynote speaker in Lake County for that event that you see at the top that was covered. We also have been in Cass County and also in Daviess County. And for those of you who don't know, this young lady right here, it's not a great picture, but that is our wonderful program director, Holly Wood. So we are definitely trying to move forward in this area as Purdue, overseeing $10 million of a $34.8 million CDC funded effort, has this goal within 2 years of bringing innovative solutions to the communities. And so these field teams have a great task upon them but again, this is really working in the communities with the communities and being driven by the communities. This is a county level call to action. Like I said, meetings that we have here. And we ask the communities at these forums to tell us what are the main focuses, what are the priorities, what is going on, and how can we move the needle forward towards a healthier community, a more equitable place to live and work and play. And so we're asking them to identify those gaps and what kind of plan can we put together to make those things come to fruition. And so some of the other things we do, how do we work in these ways of health equity and the prioritization of this initiative is one thing is we plan to help stakeholders and communities collaborate in ways that can help them secure state or federal funding. And so this is just one way, and some of you have already heard of the Indiana Together We Will mini grants that are made available. You can find more information about this on the iHope website, i-hope.purdue.edu. And there is not just this one, but there are other funding opportunities that are listed on that website. And then secondly, we're working and having those strategic sessions to help move the needle forward in those communities where they will leave with an actual action plan. And then also looking at how we are able to, in the areas of communication, be able to have some great local campaigns in the areas around their particular priorities that they have identified. And last but not least, the iHope built-in health equity analysts into each of the field teams, along with those lean process improvement experts. And these analysts are essential in the effort to connect with marginalized and vulnerable populations and groups in order to understand the reality, amplify their voice, and find ways to improve health outcomes for all. So in one community, for example, in Lake County, one of our health equity analysts, Corey Jackson, he was very instrumental here, and you'll see that in just a second. It was rumored in that county that closure of a critical hospital in a community heavily impacted by inequities spurred a resident to rally her neighbors in a grassroots effort to engage with the hospital CEO. They encouraged him to hold a community forum there for people to discuss this issue. And then Corey Jackson met with this resident at that forum and learned that she also owned a nonprofit dance studio. And this studio was created to give children access to pro-social engagement through dance. And so I think that this video of Corey's impromptu, this is just his personality, of his impromptu meeting at her studio later embodies the heart of our work, just like he's following her lead in the dance. In the community level, he listened, he heard her, he met with her where she was, and he followed her lead to support any future community-led efforts. And I'm just gonna play a little snippet here. You may not be able to hear the music, I'm not sure, but you can see that they are moving and grooving. He's learning from her. Again, the heart of the community, being really involved and listening. That is the main thing, is that we want to listen to this community and we want to be there and be involved, be transparent, and really make a difference in the community. At Lake County, for example, because of the Hispanic population there, at their forum, they actually had a speaker that did their whole presentation in Spanish. And then one of our other health equity analysts, Sylvia, actually interpreted that session for that day. Ways that you can connect with iHope is we are on social media through LinkedIn with Purdue Healthcare Advisors. We are also, and Pavlos is the actual director of, he's over the Purdue Healthcare Advisors. He's the, and so this is a quote from him: "A one-size-fits-all approach to reduce health disparities doesn't work," which we do know that. And then you can also reach us on Facebook as well. And that is with I Hope Indiana, or on Twitter at I Hope Indiana. But more importantly, we want you to connect with us. Go to our website. And again, when you go up here to programs, you should be able to go to the section that says funding opportunities, and you will be able to see all the different opportunities that we list for funding. So thank you for letting us have a moment of your time and a moment for this regional meeting. And if you have any other questions, please feel free to reach out to myself, trreed@purdue.edu, or you can also contact us through the website.
Thank you so much, Tisha. Does anybody have any questions about iHope or for Tisha online? I wasn't monitoring the chat. Anybody have any questions in there?
None right now.
All right. Well, thank you, Tisha, for sharing. If you are not in one of the counties that were in red on the map, you might not have heard from them yet. If you're in one of the counties that were the darker pink, you're probably going to be hearing from them in the next few months. We are partnering with them in Lake and Madison County. We're not moving as fastly as they are, and as many counties as they are. So we aren't able to work in all of the same counties, but we are working with them in Lake and Madison. And if you hear from them, please reach out, because they are, or please respond. They are really trying to help move the needle with health equity, especially things that happened during COVID that we knew were issues, but they were really big issues during COVID, and people were not able to get what they needed. So thank you again, Tisha. And if you have any questions and you need to reach out to them, feel free to reach out to me if you're in person. Probably everybody in the room has received an email from me in the last couple of days. So feel free to reach out to me if you want to get connected with them. Okay. All right. We are going to take a few minutes and do a little networking. I said in the very beginning, one of the things I miss the most about in-person meetings is the opportunity to just hang out with people and find out what they're doing, what they're interested in. I had a great conversation with James before the meeting, and that would not have happened if I wasn't here in person. So folks online, if you're going to get an invitation to join a breakout room, and what's on the screen is what we're going to do. So we're going to split into two groups here. Lindsay's going to have one group. I'm going to have the other group. We're going to just go around. Who are you? What do you do with your time? And then we're going to go around again, so you have a minute to think about it, and think about an interesting skill or fact about yourself to share in round two. It does not have to be a professional skill. It can be something that you do in your free time as well. Okay. All right. So I think Aaron has breakout rooms, and so he's going to send people online. And then I think if we break with Eric and go this way and Amy that way, I think we'll have pretty even groups. All right.
We'll be coming back in 1 minute. All right, folks are coming back into the Zoom room.
That was like musical breakout.
We'll give just a couple moments for them to wrap up in the main room.
You guys were having so much fun in person. We can't stop. Sorry, we're back. All right. Thanks everybody for participating in that. Again, it's 3:31, so I want to be respectful of time and so much for joining us today. If you have any questions or want to be connected with anybody, feel free to contact us at any time, and we are happy to make connections for you. It's our name, Connections in Health, so we love to help make. So feel free to reach out if you'd like information or an introduction to anybody. And thank you very, very much for participating. If you registered for this, you will get an email at some point in a couple of weeks with a recording and with the slides so that you can click on the links if you would like to. If you did not register for this and you would like to receive that, please make sure that you shoot me an email or let me know, and I will make sure to add you to the list. Save the date is on the screen. Our next regional roadshow will be in Vermilion County and featuring the work that they are working on. You can register for that by scanning that QR code, and we will be adding more information about that soon. It's November 17th from 10 to 12. It will also be hybrid. So you can join in person if you're local, and if you want to join virtually across the state, you're welcome to do that. Thank you everyone for participating. I hope that you're able to get outside and enjoy this beautiful day, because it is a lovely spring day that I hope we have another of soon. Thank you, everyone. Bye-bye.
Thank you.